Hi, my name is Matthew, and today I'm going to be presenting the impacts of social determinants on health. This presentation was made by Mason, Matthew, and Megan. So the first slide we're going to be talking about today is the key factors about work as a social determinant. The definition of work is a state of fulfilling an occupation to receive a wage or a salary. So everyone knows what work is. You do a certain job to get paid. A lot of our parents do it. Jobs with high demand and low control can lead to various problems such as stress, chronic diseases, and mental illness. So if your work is very strenuous in your body, it can be bad for your physical and mental health. And the third one says that evidence shows that stress at a workplace plays an important role in contributing to large differences in health, sickness, and maybe to even premature death. So stress is another health determinant that links to work. So they directly correlate. So if work goes up, stress. The third slide we're going to be talking about today is the influence work has on our everyday lives. So not for us yet, but adults and our parents usually have to go to work every day. Like I said before, when work goes up, when your workload goes up, stress goes up. It directly correlates. It can lead to sickness, substance abuse, and maybe even death. Conflict at work may result in violence, which can lead to racial abuse, insults, harassment, and maybe even bullying. It might not show as much because bullying only kind of happens at school, but it can also happen at work. Unhappy or unsafe conditions at work can make people dissatisfied. Reasons could be low pay, no promotion, conflicts, overwork, etc. So if your boss isn't treating you well, or your co-workers, you're not getting along with them, this can lead to satisfaction, which can decrease your workload or enthusiasm at work. Okay, so the fourth slide is about qualitative and quantitative data to work-related mental health. So this was between 2012 to 2013 to 2016 to 2017. 6% of all serious workers' compensation claims are for work-related mental health conditions. 7,140 Australians are compensated for work-related mental health conditions. So that means that if they can't work due to mental illness, they get money back for the time they don't spend working. 92% of serious work-related mental health condition claims are attributed to work-related mental stress. So yeah, these are the occupations most at risk as well. RFAs, defence force members, school teachers, health and welfare support workers. The fifth slide is about policy implications. So this basically means that how can we improve how people work? So better working conditions can lead to healthier workforce, which then can lead to enhanced productivity, which basically means if you have a better environment at work, you get the job done better. Employees ensuring appropriate rewards to employees may reduce the risk of stress, CVD, and mental health. So if the work isn't too strenuous, it decreases the risks of getting CVD, mental health, and just overall low stress. Appropriate contribution in decision making may improve productivity and create a happier workforce. So yeah, in conclusion, overall work and stress can have a crucial impact on individuals' lifestyles. So stress and work directly correlate to each other, and it differentiates a social status for health. So it can be obvious that you're really stressed at work, and it can be bad for your health. The third point, we should adopt an active working style in order to stay healthy and reduce stress. And this is the reference list. Thank you for listening.